Hey everybody, Coach JJ here. I hope that you are having a wonderful day, and I really appreciate the fact that you've taken time to tune in to my little lecture for today. Today, I wanted to talk about the topic of indulging in nutrition, fitness, or thought choices that aren't exactly the best in response to a stressful situation. This particular topic came up because I've seen many people in this group and others post about this topic. And so let me take a minute to read a little bit of one of the posts that got me thinking about this. The post went like this: what would you do when all you get is one right after another that you have something new wrong with your health? I've had so much happening, and this latest one, I now need to have a biopsy of something. I've been told there's a lesion as well. This could be cancer, possibly. I'm not wanting to go on an eating binge, as it was the way I would soothe myself. I'm trying to keep myself on the right side, as I'm proud of the 25 pounds I've lost and the fact that my A1C went from 7.5 to 6.8. How can I deal with the urge to fall back into that habit of soothing with food? This is a delicate topic, a sensitive topic. It's a topic that affects way more people than the people themselves realize, but it also happens a lot more often than healthcare providers actually realize. I don't know how often you pay attention to the questions that you find on the form when you go to your doctor's office, or the questions that the medical assistant or the nurse ask you before the provider comes in, or the questions that the provider actually asks you. But in all of my 30 years of working in healthcare, I think I've had maybe 3 or 4 doctors I've worked with that ever took the time to actually ask their patient about their relationship with food and about what's going on in their home life and, stress kind of situations. What I can tell you for sure is that navigating this kind of cascade of health challenges where it feels like you're always going to the doctor, and if it ain't one damn thing, it's another, right? It can kind of make you feel like you're playing a game of whack-a-mole, or throwing spaghetti at the wall to see what sticks, because the provider maybe doesn't know exactly what's going on. New things keep popping up, and you're telling yourself, oh my gosh, I already had to deal with this one thing and now this other thing. It can totally really make you feel like you're in an insurmountable situation, and that no matter what you do, you're just going to be doomed to continue having medical diagnoses and trials and tribulations. This is where my philosophy about the 3 M's of total health comes into play. Got to stay focused on your mindset, how you're moving, and your meals. And the meals aren't just the food you put in your mouth. We'll get into that in a second. So in this case of this particular person, they said they lost 25 pounds and their A1C went down significantly. That is no small phenomenon. That's wonderful progress. And so when you find yourself in a situation where you've received yet another healthcare diagnosis, do not forget about the achievements you have made up to this point. And just because there's something else that happens in your body doesn't mean that all of that hard work and effort that you've already put forth just needs to be thrown away and pretend like it never even happened. Every little bit that you do counts, whatever the diagnosis is. The second thing, when you're feeling that negative energy that's trying to convince you why you're justified in wanting to eat the bag of Oreos or the box of Doritos or whatever, what I would encourage you to do is to shift that energy. And one of the best ways of shifting that energy is actually getting physical movement. And this is where I like to pair in what my favorite coach, Mel Robbins, calls the 5-4-3-2-1 rule, the 5-second rule, essentially. And so what that is whenever you get an impulse in your brain, whether it's like a factual impulse or it's an emotional impulse. You have 5 seconds of time to do something in line with or against that impulse. So, for example, let's say you're walking down the aisle at the grocery store, you're shopping for dinner, you're really upset about that conversation you had with your boss. You're thinking maybe they might change your position or terminate you or whatever. You're feeling stressful and you're telling yourself all these things. You're walking down the cookie aisle and you end up in front of the section with the Oreos, and your brain is telling you you deserve to eat those Oreos because your boss is such a jerk. And why do you even have to put up with this? Nothing you can do to change it, but you can eat these Oreos. Let's go ahead and eat these Oreos. That's what your brain's telling you. When that process starts happening, you have 5 physical seconds in the space-time continuum before your brain will start trying to convince you all of the reasons why you should just go ahead and buy that box of Oreos. In fact, buy 2 or 3 of them because damn it, you deserve it. If you want to do the opposite of that, you have 5 seconds from that first thought about I should do this to tell yourself, no, I'm not going to do this, and then pair that with a physical action. So you're walking through the grocery store, you have the impulse that you want to buy junk food, whether it's Oreos or beef jerky or whatever it is, but you know that it's not very good for your body. You then say, nope, I can do something different. And then you physically walk away from that item that is calling your name. Doing that physical movement helps rewire that thought to that physical movement. And the more you practice this, the easier it gets. So with each subsequent time you are at the grocery store and find yourself in that Oreo cookie aisle, you will remember last time, oh yeah, I know I said I wasn't supposed to do that. And I know I'm not supposed to do that. Let me just walk away now. And pretty soon it'll just be like second nature, where that impulse might come, but it's instantly gone because you have taught yourself, you've wired your brain to do something different. Another thing is that a lot of times we find ourselves in these stressful situations. We think about what are we going to do? And then we realize we don't have a plan. So this is where planning our nutrition comes into play. And people say, oh, well, it's hard. You know, the cost of groceries seems to be raising every week and we don't know what's happening. And I go to the store and they don't have this or that. No, and I don't have time to stand there and cook this giant fancy meal. And I really want, X, Y, or Z food. This is why you plan in advance and then you have to make yourself stick to it. It's very easy to decide, well, I don't feel like fooling with this. I'm just going to stop at the Jack in the Box or the McDonald's or the Subway or whatever it is. Even if you really don't feel like cooking, you really feel the urge to eat from these fast food places or other places, you still have the capacity to make the healthiest choice possible. You just have to plan inside your mind that this is what you're going to do. It's almost like making a compromise with yourself. Yeah, I'm aggravated, I'm irritated. The boss at work irritated me and oh my God, my kids are going to get on my nerves the second I get in that kitchen, start cooking. I can't do it. I have work to do at home and my kids will be annoying and I don't have time to cook. So I'm going to go ahead and get this fast food. Well, can you order a lower carb item? Can you order it baked or grilled instead of fried? Can you sub out the French fries for a baked potato instead, or a salad, or a soup of some kind? Instead of having the Coke or even the Diet Coke, could you just get a water? How about a club soda with a little bit of lemon juice or something? There are things to do. You just have to plan to choose differently when you're faced with that situation. So why do I even talk about mindset movement meals? reason is that I've been in healthcare for 30 decades and I've taken care all different kinds of patients. I started in healthcare back in the day when we used to have physical human telephone switchboard operators, because that's where I started when I first started at the hospital. Anyway, I've been around for a long time, and I've seen time and time again that the patients who come down with a condition, whether it's genetic, whether it's an infection or environmental exposure, whatever it is that happens to them, the patients that strive to maintain a positively oriented mindset are the patients that recover quicker and are able to improve their lives, actually. The patients that don't carry a positive forward thinking mindset are the patients that either don't recover, or if they do recover from this particular event, more events come along and they just keep adding to the stress, and the person ends up being not just unhappy, but they don't feel very good either, tired, and they lack energy, maybe they lack mental focus, stamina, things like that. Having a positive mindset is so, so, so important. It's okay to be scared. It's okay to be irritated and, quite frankly, pissed off about this next thing. Why do I deserve this? It's all right to have those feelings. To pretend like those feelings aren't there is to just be dishonest with ourselves and everybody else around. You can acknowledge those feelings, but it's kind of like being in a parking spot, like going to the mall, for instance. You go to the mall, you go in there for a specific thing or a few different things. You park your car, you walk in, you go, you get your stuff, you come back out, you get in your car, you leave. You don't live there. So even though you might have these feelings of intense frustration, you don't have to live there. And there's practical things that you can do to pull yourself out of that. Perhaps one way that you can keep remembering the positive is to maybe create yourself a little victory log, which is an interesting concept, because if you think about it, a lot of times we make lists. We make a grocery list, we make a to-do list, we make a goals list. But most of us don't ever actually spend time writing down the things that we actually did accomplish, the successes that we actually had. So if you were to maybe make yourself a little log like that, hang it up where you can see it, it might serve as a good reminder to keep you in that positive mindset, to remind you of how far you've already come thus far. Another aspect of this is the movement. And it's not just the physical movement, it's how we move our soul and our spirit on the inside. But gentle activity actually can help improve your emotions. And this happens for several reasons. The most important one is the fact that engaging in a gentle activity, especially one that lets us use our hands, is a wonderfully brilliant way of distracting ourselves from the immediate stressor that's happening. It's not just about physical health. Sometimes we need a mental break. So let's say, you've been stressing at work, you've been on the phone all day, your boss is on your tail about getting projects done, and you've been clicking and clacking away at the keyboard all day. And you're like, oh, I can't wait to get out of here and just go vegetate. And your idea of vegetating is, I'm going to go pick up, a 20-piece chicken nugget from McDonald's and a large fry and a Diet Coke. And I'm going to go sit somewhere and I'm going to watch, an episode of X show. That's gentle. And I guess it's an activity, but it's going in the wrong direction. If you instead could perhaps take yourself to a local park that has a bench, and maybe you could bring a journal book with you, or a coloring book, and some colored pencils or some markers or something. You can get in touch with nature. You physically took yourself outside, and then you have this book or this whatever in your hand that you can do something with, and none of those things involve eating. Yet by the time you finish doing that activity, even if it's only for 15 or 20 minutes, you will have been able to distance yourself away from the stressful situation enough to be able to step back, get some perspective, and hopefully make better choices for your optimal health. And then, of course, the meals component, right? So, as much as diabetes is about our genetics and our environment and stuff like that, and it's about how we physically move our body and things like that, it's also very much about the food that we eat. Um, Sometimes we need medication. Certainly, in the case of type 1 diabetes, your pancreas doesn't produce insulin. In the case of type 2, maybe it still produces insulin, but it doesn't produce enough, or your body is resistant to the insulin being produced because there's other chemical factors going on. No matter where you are in your diabetes journey, what you put in this mouth of yours absolutely matters. And there are foods that you can eat that can support your body. I don't like telling people to restrict themselves because often when we restrict ourselves too much, it kind of makes us feel like adolescents again, and we tend to develop a bit of a spirit of rebellion, almost like wanting to cheat the system, if you will. And so we have to step away from that kind of mindset with regard to our food, and then understand that everything we put in here is supposed to be fuel and support for our body. And so, okay, how does that relate to me feeling like I have a craving for something? Well, let's say you really want French fries. I'm not going to sit here and tell you you shouldn't eat French fries. What I am going to suggest, though, is that you make your own. Or let's say you buy a pack of frozen French fries from the store. Check the ingredients. Make sure they don't have a bunch of added chemical additives and preservatives. And take them home, bake them in your oven, or fry them in the air fryer. Even though, you may have been told, well, your diabetics aren't supposed to eat potatoes. Don't even get me started on that lie. It's a lie. It's not exactly true. You still want potatoes. Well, you're going to be doing yourself a favor by making those French fries yourself in your home kitchen, as opposed to giving your $5 to the corporation that gets billions and billions of dollars every day, right? Same thing with like sweet treats. Maybe you want something sweet and crunchy. Well, instead of reaching for the Oreo, you could make yourself some granola. You could make yourself some sugar-free vanilla yogurt with some crunchy chia seeds and maybe some roasted pecans or things. Goes back to the planning part. You have to plan to make the good choices and then do the steps in order to do that. And this goes along with the meal planning part. If you plan ahead, I'm definitely going to eat stuff. Then one of the things that you can do is make sure that you have readily available snacks. So when you feel that urge to indulge in something crunchy to get your mind off the situation, you have already pre-planned, okay, well, I know that I'm going to want to eat something. I know I'm going to be stressed out. And this is the thing. I have the 5 following healthy options that won't jack up my blood sugar or cause me to have a blood sugar crash later. Let's see. I guess lastly, I would say you have to honor your emotions. Don't try to pretend that you're not upset if you are. Don't try to pretend that you're not sad or really pissed off or whatever it might be. Recognize and own the feelings that you have, but recognize that those feelings don't have to control you. At the end of the day, you are in the driver's seat. Secondly, find comfort in getting some movement, whether that be going to take a walk, whether that be sitting yourself at a park with that journal book or coloring book, whether that be cleaning a closet in your home out that needed to be cleaned for a while or something. Just any little bit of physical movement where you're physically having to do something, especially with the hands, will again help you step back from whatever situation is triggering you to have the desire to indulge in habits that you know are not beneficial for managing your diabetes. And the third thing, the nutrition piece, feed your happiness. We're not saying that you should not eat food if you're mad, or you shouldn't eat food because you're happy. Eat foods that you know will bring you joy, but will also bring your body the nourishment that it so desperately needs. And so those are Coach JJ's thoughts for the day today. I hope that what I've said has made sense and has given you some things to think about that you can apply to your own life. And I hope to hear some feedback from you guys on what you think about my thoughts and my ideas and suggestions here. As always, I welcome your feedback in the comments below this video. And don't forget, if you haven't already, check out my book on Amazon. And I'm working on more books, and those will be ready when they're ready. And on that note, Coach JJ out.